Good morning, afternoon, whenever you're listening to this. This is Linda Taylor, Medicare Made Clear presentation today, part two. I am I am Taylor Your Insurance, and I am a career agent with United Healthcare. Today is a strictly educational meeting. Medicare Made Clear is written or produced or published by United Healthcare, but it is in no way has anything to do with any of their plans or in any way advertises United Healthcare. It's just as good a book as I've seen to explain Medicare. If you listen to part one, we went over the parts of Medicare: A, hospital; B, doctor; D, drugs; and C is an advantage plan. Part C combines A plus B plus D to give you the different plans. That was basically what we went over. So part two of this video is going to be about the drug plan. So if you will, if you have the link in front of you, or if you picked up a book at your local library, Rolla Public Library for sure, turn to page 22. And we're going to talk about the prescription drug plan. And first, but not least, we'll get into it a little more later, but some people say, I don't take any drugs. Why do I need a drug plan? Well, I don't have accidents. Why do I need car insurance? I've heard that a lot of times, and then the next week they have an accident. In order for Medicare to keep the prices low, they need people to participate. And so people need to have a drug plan. They range anywhere from the mid-teens to maybe $60, $70. Middle of the road one is $34, $36, somewhere in there. So they're not bad, but they help you with paying for your medications. Some medications can be in the thousands, and you never know when you might have to go on something. And so anyway, if you don't take a prescription drug plan when you're 65, you do get a penalty for every month that you don't have one. It's small. This year it's about 32, 33 cents a month. But if you didn't take it for 10 months, that can mount up. And every month thereafter, you have to take that or pay that penalty, and it can really mount up, after 10 or 20 years. So you don't want to do that. You want to get a prescription drug plan. If it depends. If you have a supplement that takes care of the extra cost for Medicare, then you would have an extra or a standalone drug plan. If you decide to go the the option 2 way, then the Part D plan is included. The only way that you wouldn't need a drug plan is if you are military and you have the drugs given to you, or you pay a copay for them through the military, and thank you for your service for sure. And that is comparable to the Medicare drug plan. So you would not need to take a drug plan out. So anyway, you have your brand name drugs, you have your generic drugs, and every plan that's out there has their formulary. Formulary just means the name of the plans that are on their list of drugs. Now, one insurance company has an agreement with one drug company. The next insurance company has an agreement with another company. But in the actual drug companies or drugs categories, there are several different drugs that are out there in that same category. So if one company doesn't have it in that particular name of the drug you're taking, there are probably 2 to 3 to 4 different drugs of the same type. It just might be by a different name. And so you consult your doctor, and you may be able to get that same a type of drug, just on a different name, and go with that same drug company. But if it's not on their formulary, it's not going to be covered. Very, very rarely, unless there was nothing that would work but that particular drug. And we'll talk about how you can get that later. But if it's, you always have to check and make sure your drugs are on the actual formulary list, as well as seeing if your doctor is in the list on an Advantage plan, if it's an HMO or a PPO, where it would cost less if you go in network. So your doctor and your drugs, you need to always check. Okay, what is it covered by Part D? Any drugs that aren't on the formulary, drugs that are prescribed for anorexia, weight loss, weight gain, drugs to promote fertility, erectile dysfunction drugs, drugs for cosmetic purposes or hair growth, vitamins and mineral products. Over-the-counter stuff is not covered usually. Non-prescription drugs, and drugs that may be covered by Part A or Part B. Part A, if you're in hospice, they may cover your drugs. Part B, a lot of chemo drugs are administered in a doctor's office intravenously, and those would be an example, not always, but an example of possibly a Part B drug that would be covered under Part B instead of D for drugs. You can use different pharmacies on different plans, but if you use their preferred pharmacies, often you get a little bit better deal on the price. Usually, if you go the mail-in route, you can save quite a bit of money. You get 3 months, usually for the price of 2, or on tier 1 and 2. And we'll talk about tiers in a minute. Usually that's the generic drugs. You can even often get 0 price for those drugs. So it just depends on the plan you're on and what kind of a drug it is. But many, many times you can even go as low as a 0 copay. So, okay, we'd already talked about formularies and the tiers now. Tiers are... You notice the dollar signs. As you go up the tiers, you go up in price. And that's what you need to remember. Tier 1 and 2, some companies don't charge a deductible, or in fact, most companies, for 1 and 2. And there is a deductible sometimes, most of the time, for all the companies. But 1 and 2, a lot of times there's no deductible, which saves you money. Tier 3, 4, and 5 usually has a deductible, but some of the companies don't charge a deductible on tier 3, but it does cost more. These are your newer drugs where tier, and they don't have a generic yet. Tier 4 and 5 are your really high expensive drugs, and usually tier 5 is your, chemo and the really high-ended drugs. Sometimes you might even go to the company and ask to be on one of their discount cards. And a lot of times it'll say, we do not give discount cards out to Medicare people because you already have, good coverage. Well, if your drug is $1,000 a month or $4,000 a month, I know people that have gotten on those discount cards because that's a lot of money a month, and you may be able to try it. You just write the company and talk to your agent about how to possibly, get into those companies, but you make a call or write them and see if you can't get on some kind of drug help when you get up into those large amounts. So, excuse me. There are certain ways that you may not be able, or may be able to get your formulary if a drug is removed from the market, and your plan doesn't cover that. You may be able to get another drug. Okay, so it's just right there on the right. It just talks about the way to consider formulary and generics. If the generic doesn't work, your doctor may write a letter and say it doesn't work. You have to have it, and that's usually called step therapy. And that's when you have tried the lower cost generic drugs, and you've tried and it doesn't work, it didn't help you, and your doctor just writes a letter stating that it didn't work, that drug, and then the company usually will consider it and find out, and get you to be able to take the name brand drug. So step therapy, you have to try the lower cost first, and then you go from there. Now, the next page kind of explains better than reading all that. There are 4 parts to a drug plan. We thought this third one was going to be gone, but it's still with us for next year as well, 21. The first part is the annual deductible. You have to have no more than, I think it's $435 in 2020. And I can't remember what it is for 2021, but it is, it changes every year, but it's somewhere in 400 and something. And once you get to that, then you go right into the initial coverage. Not all plans have a deductible, and they're different amounts in different plans. So it doesn't really matter what it is. Each year it's different, and you don't have to worry about it. But once you reach your deductible, then you go into copays. And tiers 1 and 2, many times you don't have to pay the deductible. And some companies, you don't have to pay the deductible for tier 3. So it just depends on the company and what their plans are. A copay is that you pay like a $10 or $20 or $40 copay, just like you've been used to in your regular health insurance. And once you and the drug company have accumulated $4,020 in 2020, that's your initial coverage, with your copays and plus what they cover, then you would move into the coverage gap, or the donut hole, the deep dark hole. You'll hear everybody say, oh my gosh, I'm in the donut hole. Well, again, this was supposed to go away, but it hasn't yet. And that's where you pay yourself, not the insurance company, 25% of the cost of brand name and or generic drugs in 2020, up to $6,350 out of pocket. Now, 25% of $1,000 a month or a $4,000 a month drug, that can be pretty awful when you're in that donut hole. And those high ones can get you pretty quickly, up to that $6,350. Hopefully, most people take generics, and I don't have but a few people out of my clients that ever get up into that donut hole. Hopefully you wouldn't either, but you just need to know. Everybody forgets about it, and I get a call and they say, oh, my drugs went up, I'm having to pay all this amount. And I say, do you remember me going over the donut hole? And they said, no. And I said, well, we did. And it's easy to forget about it. But if you get into that, it's a hard place to be. But once you get out of that, you go into catastrophic, and it's a very little copay, very little co-insurance, and you stay in that part for the rest of the year. So you kind of drift through that part. Very small copay, $5 or 15%, I believe, of the big stuff. So it's not too bad. You pay, your payments and of your premiums and your out-of-pocket costs, and that's just what the drug things are. Now, there is a way that you can get help on your medication. It's called extra help, and you can get that through Social Security if, and I always have to look it up, if you're by yourself, you don't make over $1,595, and you don't have assets over $14,610 this year. They do change it each year. And if you are a couple, it's $2,155, and you don't have assets over $29,160. Now, if you own your own home, that's okay. But if you own other property, if you have a paid up life insurance policy like a whole life, that counts. That does count as extra money in the bank, I guess. So anyway, you may not qualify, but always try. You call or go on to ssa.gov, Social Security, the website, and you can apply like in 15 minutes, and it doesn't hurt. You get something back in a couple of weeks to see if you qualify for extra help, and that will put you where your medications, you won't pay for a premium on the drug plan. Or if you happen to ever have had a penalty, you didn't get a drug plan at the first of Medicare, then that'll take over that. And even if you had an Advantage plan, your cost would be greatly reduced. And if you wanted to change a plan, an Advantage plan, sometime during the middle of the year, every quarter, with the exception of the 4th, you can change, but it goes into effect January 1st. You can change your plan if you don't like it. So getting extra help is a good thing. Now, you do have to add your $144 amount that you pay for. It's $144.60 this year that you pay for your Part B back into that. So anyway, you've got your premium, what you pay for the plan. The deductible is what you have to pay up front before the main part of the plan kicks in. Deductibles aren't usually in the tiers 1 and 2, and some plans 3. It's the most is $435. Some plans have it less. Co-pays are what you pay up to, like $10, $15, $20 for the amount that you have to pay the pharmacy after you get through that deductible for your different drugs. And co-insurance is when you get up into those high-end drugs, like the tier 5. It's different co-insurances where you pay a percentage of the drug. Don't forget about your extra help. That's a biggie to help people. We used to have Missouri RX for everybody. Now people on Medicaid have Missouri RX, and that's a wonderful plan where the state of Missouri picks up half of your copay if you make under a certain amount of money. It's supposed to have gone through about a year ago. Something happened. They didn't find the money to do it. But a lot of people had this 3 or 4 years ago, and it's a wonderful thing to have. And I'm hoping that it'll come back eventually. But people on Medicaid have it, and it pays for half of their copays. So if you have questions, call me, email me, text me. My phone is on all the time. I work nights and weekends. It's Tailor Your Insurance. Even if I'm fishing, I have my phone with me. I always love to talk about Medicare, actually. First 3 years I was in it, I went crazy. It was the hardest thing I ever tried to do. But rather than you sweating and not knowing, saying, oh, it's awful, it's hard, just call me. We'll go through everything. Watch part 1, watch part 2. Give me a call, 573-578-5333. I really do like explaining it. I think it's great. It's a great plans out there, and I'll be happy to tell you the different parts and how it works. So it's been great to visit with you for 20-30 minutes. I don't know where we were on time, but just study it and enjoy that you are going to have lots of good insurance now. And I'll get with you when you look at part 3. And it'll be just kind of talking about the different types of plans you can go through and the ways that you may be able to get some more help. Thanks a bunch. Linda Taylor, Tailor Your Insurance. It's been lovely.